A lot of patients ask me a question quietly. Doctor, can I still drink alcohol if I have diabetes? It is a fair question. And the answer is yes, sometimes, but depends on what, how much, and how often. So let's break it down. Alcohol affects your blood sugars in two ways. First, it can cause a sharp drop in your sugars, especially if you drink on an empty stomach or you're on insulin, sulfonylurea. Secondly, the sweet mixers like your Coca-Cola, your juices, your liqueurs can spike your sugar very quickly. So if you're not careful, alcohol can cause both highs and lows, often without a warning. Let me tell you about Rohit, a 35-year-old executive diabetic on metformin. Occasionally drank whiskey at parties. One night, after skipping dinner, he had 3 large drinks. He fainted. His blood sugars had dropped dangerously low. He didn't even feel it coming. After that scare, we made a plan, him and me together. Now, he eats a protein-rich meal before a drink, limits himself to 1 drink, avoids the sugary mixers. So there's no Coca-Cola, no packaged fruit juices with him. He had no more episodes and his sugars have stayed stable. So the golden rules for drinking with diabetes. 1. Never drink on an empty stomach. Always eat good amount of protein or fiber before you have a drink. 2. Limit to 1 drink per day for women and 2 for men. No drinking daily. Choose wisely. Best is dry wine, plain whiskey, gin, vodka. The worst are cocktails, beer, your sweet wines, any of your cocktail mixers which have high amount of sugar, they're bad for you. Sip slowly, don't gulp. Always check your blood sugars before and after drinking. Tell someone around you if you have diabetes and you're feeling giddy or sweating or feel confused. Also remember, alcohol interacts with your medication. It increases risk of liver issues. So it may also lower your willpower and you'll end up eating sugary foods. And if you're already struggling with poor sugar control, you're suffering from fatty liver or pancreatitis, avoid alcohol. It's not about the shame or judgment. It's about keeping your body safe. So can you drink with diabetes? Yes, responsibly, occasionally, and always with awareness. Thank you for joining me on Sugar Unfiltered. In our next episode, we'll talk about how diabetes affects the eyes and how to prevent blindness. Until then, choose clarity over calories. Enjoy life without losing control.